Hello all, this is Dr. Nazeeb, MS General Surgery in Ayurveda, Chief Anorectal Surgeon at the Rectum Clinic, a complete Ayurvedic surgical center, Hyderabad. So I want to tell few things for all the upcoming Vaidyas. So be a Ayurvedic doctor not just by degree but by depth of knowledge. As an Ayurvedic doctor, we must deeply rooted in our classical knowledge like our Samhitas. Along with we must know all the modern diagnostics, pharmacology, pathophysiology of the disease, surgical principle, and we must know research methodology also. Nowadays patients are living in 2026, not in 2000 BC. So always integration is must. Integration strengthen our system, and if you won't integrate, it will become weakness for us. Okay. And second most important thing is, as an Ayurvedic doctor, we must always speak with logic, not with emotion. Okay. And we must always treat a disease with evidence. Okay. For example, if you treat a patient with emotion, he will likes you, but if you treat a patient with evidence and logic, he will trust you. Okay. This is very important. And Ayurveda is not a mythology. Okay. It is a systematic science, depends on few principles. Okay. Like Trisutra Siddhanta, Hetu Linga Aushadas, Tridoshas, Saptadhatus, Dashavida Parikshas. There are a lot of things are present in this. Okay. And when you explain a disease with pathophysiology of the disease and Ayurvedic Samprapti, and when you correlate results of dosha, dhatu, mala with lab findings, and along with when you document these results and then present, then society will accept Ayurveda as a science. Otherwise they will just ignore you. Okay. So otherwise they will consider you as a person who knows plants, who knows herbs. This is not at all acceptable in 2026. Okay. And always be proud a Ayurvedic doctor, but be a balanced Ayurvedic doctor. Okay. So every system has its merits and demerits. So we should not fight for supremacy of the system. Okay. Our goal must be patient recovery. So okay, we should fight for patient recovery. If patient recovers well, medicine wins. Okay. This is a very important thing, and we must always proud to say I am an Ayurvedic doctor, but that proud should come from competence, not from emotion. This is very important thing. Okay. And always update yourself. If you won't update, you will left behind. Okay. Knowledge without practice, it will make you incompetent. Okay. And practice without updated knowledge, it will make like outdated routine. It won't help you, neither it will help you nor it will help the patients. And as Ayurveda is evolving, there are a lot of research is going on. There are newer clinical protocols are developing. There are new surgical techniques are evolving. So if you won't update yourself, you won't enjoy the real power of Ayurveda. That is very important thing. So you must always update yourselves. Updating yourself is not an optional. Okay. It is a survival. That is very important thing. And I will give an example. So as an Ayurvedic anorectal surgeon, previously we used to apply Ksharasutra for long tracks. Yes, Ksharasutra is very effective, it works wonders. But when you apply Ksharasutra for long tracks, it will take many months to heal. But nowadays there are a lot of Ayurvedic surgical techniques, new surgical techniques developed, like IFTAC, interseparation of fistula stack, and applying Ksharasutra by Dr. Manoranjan Sahu sir, Padma Shri Manoranjan Sahu sir, and MIKST, minimal invasive Ksharasutra technique by Dr. Hemant sir, MIKKS. These are the new Ayurvedic surgical techniques exclusively developed by Ayurvedic surgeons and based on Ayurvedic surgical principles. So these are the very important thing. After developing these techniques, patient recovery time is drastically reduced and recurrences also reduced. Okay. Post-operative pain also reduced. This is the importance of updating your knowledge. And finally, I conclude after saying, be a proud Ayurvedic doctor, but be a logical, evidence-based, documented, scientific Ayurvedic doctor. Okay. This is need of the hour. okay, and it will help in growing personally and professionally, and this will help in growing of our Ayurveda. Future of Ayurveda depends on how scientifically you treat a patient now. Okay, this is very important. Thank you so much.